Good morning, everyone. Thank Mr. Chair. Today I would like to present about the Cambodia malaria surveillance system in Cambodia. So, as a government strategy, Cambodia is set a goal to eliminate malaria by 2025, and Malaria Consortium is to play an important role in supporting the malaria system to National Malaria Center of Cambodia since 2009. So, in a national malaria control program, we have 5 different tools for a surveillance system, but I don't think I cover all of that. So for this presentation, I cover only the two main tools. One is a malaria information system, we call MIS, and malaria alert system, we call DESRO. So we have 5 tools. One malaria information system MIS that contain store all the data that involved with the malaria cases. And second tool we call DESRO positive alert system that report by SMS technology that use frontline software. It's open source. And third tool we call malaria alert system. We call DESRO. It get the idea from the DESRO positive alert system that we cooperate with the INSTAT organization to help us to develop that system. The same thing, referral system and stock alert system also we cooperate with INSTAT as well to help us to do it. So for the MIS, I think some of you probably know about that. When we talk about the malaria data in Cambodia, people will know about the MIS. We call a malaria information system. And that system is designed in Microsoft Access, and it's a desktop application. It originally it's designed by Steve Miller in 2009, and this system I take handover from him since 2010. As I mentioned previously, there are 4 main datasets in MIS, but actually that in that system we have many data that store. But the main thing that we have update every month, we have only 4. The main thing is the first one is village malaria worker report that contain the malaria case that detected by BMW, and second is malaria case that detected by health facility, and third is the number of net that distributed every year, and the last one is a private provider that we collect the malaria case that treated in the private provider. So we have 45 OD staff who the main responsible for update data and entering the data in monthly basis in 20 provinces. Why 45 staff? Because in Cambodia right now we have 81 OD, but among those 45 OD is the target OD, is the malaria OD. So this system also we all usually produce the bulletin every quarter from that system. So this is the user interface of the system, and you can see data entry section. We have BMW report, health center, bad net, a lot of things. But we store only main that I mentioned in previous slides. So this map is so about the location that we already installed the MIS already in 20 provinces, among 24 provinces, and 45 operational districts, among 81 districts in Cambodia. So this is the activity that we have trained the OD staff and had PhD staff to use the MIS and basic data analysis every year. So I want to show a quick. The up form one is the data entry form in MIS system. It's just one form among many forms in the system. And after they enter the data, they can produce a report. They can produce a report like this. Also, this system can produce the graph as well. So we don't need like expert statistic or access. Just press the button, the system will generate that graph or report automatically. And also from the system, user can plot the malaria case in Google Earth as well. And this is one page of the bulletin, but in bulletin have many pages. I just show you this in the front one that we create from the MIS. And this is the data flow of MIS. That the sender is the operational district staff. After they enter the data, they have to send us by monthly basis to the provincial health department and the national malaria control. So the data update every month. This is MIS, but now I want to show you about the DESRO system. So DESRO system is the system that report the malaria cases in real time by SMS. And this idea, if we take from the Day3 system that we design this system in frontline software, but that software is very limited of the content, the amount of the large SMS. For example, like we have 1,000 cases per day, for example. So when the user sends the SMS to the system, that system cannot carry and respond on time because of frontline SMS is use the SIM card. So that they decide to change from frontline to the web-based that we cooperate with instead organization. And for the code, for the when the user take to the system, if we design very simple, because of the user is a VMW, village malaria worker, is poor knowledge. That's why we try to design the code very simple for them to report us. So the code we have 5 digits, and we're supposed to send by VMW and the health center staff. So the code is like this. So the first section, the first part is species of the malaria, and second part is age of the patient, and third part is sex of the patient, and fourth part is the test. It means that, for example, like we have a special study in Thailand, we study for Malaria project, we have to follow up the patient in 28 days. So sometimes one patient we test 2 times. First time we call day 0, in the first time we call day 0. And if the patient have falciparum, we need to follow up in the next 28 days. We call 28 days. That's why we have the day 0 and day 0 and day 28 here to identify first test or second test. And that the fifth part is that it means that the patient that we take the test is the patient is located in the same village or they migrate from another village. So if that, it means that migrant patient. And this one is a village code. This is for health center staff only, not for BMW, because of in the health center there have many patients from different village. That's why we identify the code of the village. So this part is for the BMW. No need, because BMW is all the patients we suppose come from the same village, so we don't need the village code. And a whole part, the extra one, is for health center, because in health center have many patients from many village, so we need to identify which BMW come from, or which patient come from. So for example, like here, we have F23M0, it means that that patient is have falciparum, and that patient have 23 years old, and male, and it's the first time. 0 it means first time. If it's 28, it means second time. And in 2011, we implement this. Only 3 provinces, but now we plus 1 more province in Thailand. In total, we have 5 OD with 298 VMW and health center staff. I'm not sure about more than 20 health center that we provide with the basic phone and solar charger. Basic phone is like this. We provide, it's cost about around $30. And this is activity that we cooperate with Instead and Mobitel. And Mobitel is a telecom company in Cambodia. This system is very successful, and we call unique system because of we a lot of partner to cooperate. For example, like Mobitel provide a special SIM card, 1,500 SIM card. That SIM card is very special. Why special? Because of that SIM card, no expiry. SMS to that system, no charge. Without the SIM card, no credit. That's why our system very low cost. And this is activity that we train BMW in Kosala Health Center in Kampot Province. And this is the equipment that we provide to the VMWs. We have solar charger, this is the phone, and this is a guideline for use the SMS, and the lights that charge from the solar charger. So this is the data flow. So when a BMW or the health center take the test, they need to send to our system, and the system automatically check the SMA is correct format or not. If not, they have to send back to the user, to the sender, and tell the sender, please send the data again to the correct one. And if we check that if the system correctly is in the valid format, the system automatically format that SMS to the relevant people for intervention. So, for example, like this, they send SMS when they take the test, and then system check that SMS is correct or not, and then they respond back. After the check is correct, they respond back, told the sender that you are send the successful correct one, and then system will format that information, forward that information to the CNM or OD staff or provincial staff to intervention on that place. So this is it's a system, user interface system that in our system. So when the sender send to our system, they look like this. We have the date of the receive the SMS, and we know the sender, and we know the number of the sender and information that we said previously. And this system also useful here. We can write something. For example, we would like to send the message to the user. For example, like provide some information urgently. So we can write here, and then we can press one button here. One message can spread out 1,000 users that already registered in this system. So you can see here, we can plot all the case that report by BMW or staff in Google Map. And probably you wonder why we can plot in Google Map. Because in the SMS, we don't have the coordination of the village. For example, like it's just feature phone, but we can plot the case from where is it. The trick is because we have the village code. We predefine the village code here, coordinate of the code there, so we know the case come from already. So I think I just one more referral system. I think just mention only one slide. The idea we have another system we call referral system is for track the malaria patient that come to visit private provider, and when the private provider refer them to the health facility, the system want to track they go or not. If not, we have field assistant to track them and follow up them to treat. So the idea is when the patient come to the private provider give them with the unique slip code and told the patient to the health center. And the same time, private provider will take SMS with the unique code and the phone number of the patient. And SMS will send to the health center automatically. So when the patient come to the health center with the slip code, the health center will send SMS to the system. System will forward that SMS to the private provider to tell private provider that the patient are already arrived at the health center. In 2 hours, if the health center don't see the patient, we have a field assistant to follow up. If don't receive any message from the health center to confirm that patient come to the health center, field assistant will follow up to the patient by call to the patient where you are, where you go. So we need to track them and make sure that they go to the health center and treat the malaria. So right now I want to show you about the challenges for the malaria information system right now. Yep. So the main challenges right now we have with the incentive for staff who are responsible for malaria information system at all this stuff. Dr. Babu, I think you know this very clear, and hopefully you end up and CNM will solve this very quick. Without this, when we difficult to push them to enter the data for us. And the data management and information technology knowledge of operation is still limited. So some OD still sometimes they have a virus and always format the computer. Sometimes it lost everything, and it happens every month. And one more thing is, as you know, Cambodia is a developing country. So the number of health center, village health center, village health center, operating statistics, even the province are changed, and some create news. So infrastructure of the database has to change as well. So we need a lot of change and a lot of update. And it's an important point as well, because of now we lack the human resource to check and follow up the data quality control. Right now, CNM have only one staff, but that one staff have another responsibility as well. But right now only me, the main person to respond that. But soon, hopefully, we will recruit 2% more. And for this role Malaria system, first thing, the main challenge is we difficult to train them on how to use the phone. Why? Because of VMW, village malaria worker, is live remote area. Some people they don't know, they don't never use the phone before. But some use it, but just call. But now we try to them to use with the SMS. Sometimes they are the farmer, their finger very big. So sometimes you can see the button of the phone, never rise. Touch it, never rise. So very difficult. And some phone, when we provide them, some phone is been lost and broken. And as I mentioned in the previous slide, we have cooperated with Mobitel that provide a special SIM card, but that SIM card is that company has limit of the coverage. So some area that company not coverage in the remote area. So we need to negotiate with another company to provide more SIM card. So the next step is we will update MIS to the web-based system, because right now MIS we use with the access is a desktop application. Why in the beginning why we decide to use desktop application? Because of in the OD in 2010 we don't have the internet access in every OD, but right now the internet access is cover, I think, a whole country. And strengthen the data quality control, refresh training every year, and we suppose for this year we will train them workshop in May, and update malaria information following national program, national malaria control and operational district staff requirement. So our system still update every year, because of when they use it more requirement, more change, adjustment. And for this role, we will deal with another mobile operator, another company, and National Malaria Control Program is implemented for this year to expand our country. And we still, this is a big debate. We still replace basic phone with a smartphone or not. We're still not sure, but I have some pro and con with smartphone. So if you replace with smartphone, pro is we have a friendly user interface. Why friendly user interface? Because when we use a smartphone, we can design special app. For example, like male or female, we have up here in the screen. The user just press it, or maybe some user can read. We can put the picture, easy for them to use. No need just like this phone, go to message and blah 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 long step. And we can collect more information than this phone. And reduce invalid data that's sent from the user. As I mentioned, the user when use this, a lot of easy to make a mistake. But okay. I try to finish early, very quick. And the price for smartphone now is very decreased every day. So the smartphone right now around 80 or 100 we can buy it. So for the lesson learned, we can for the marine information system is easy to manage and maintain extra data, and improve marine information system in Cambodia, and we can build the capacity of national marine control and operational district staff in terms of data enrichment, and get feedback from the OD staff to update the bulletin in Khmer. And for the DESRO, we introduce the new technology to community level and get information from the remote area in real time with low cost. Effective low cost communication system linked with all BMW and health center with national and district staff. Cost effective only during that time, we only spent only $100 per user setup cost. And also we use Khmer script and software can send SMS to all defined group. And in management we have donor UKS, Global Fund, Instead, and Cellcard. And also would like to thank with Aransha, and I'd like to review my presentation. Thank you very much. Okay, thank you.